So we are living an absolutely normal life. I have to wear masks when I go on public transport. If I go to a restaurant, I have to click in a QR code. There's capacity limits on offices, but basically we have zero virus circulating in the community. So how did we get there? The first thing is we imposed strict external border controls more than a year ago. We were one of the first countries to impose border controls in the world. Secondly, we had internal border controls. We had green zone states and we had red zone states. And where I lived turned out to be a red zone state, critically in the middle of the year with a second wave. And the other states closed their borders to us. And so we couldn't travel. Thirdly, we also had intrastate border closures. So the city of Melbourne, for example, I couldn't travel to rural Victoria. Fourthly, the government had a social license to act. The public was fearful of the virus. They started restricting their own activities before the government imposed restrictions. And so there was important community support, community solidarity about responding to the ravages of the virus. Also importantly in Australia, the political spectrum is limited. Basically, all of the mainstream parties, not all the MPs incidentally, all of the mainstream parties were recognised the issue of COVID and thought that we should do something about it. There was divergence in opinion across the country about how strict we should be, how strict the lockdowns should be, but there was consensus that a public health response is the critical thing to do, and that, especially in Victoria, a public health response was also the best economic response. People don't go out and buy things if they are fearful of dying.